Hi everybody, my name is Miranda and I'm going to show you how to properly use your take-home bleaching tray so that you can get the maximum benefit of whitening at home. So for starters, we highly recommend that you get a professional demo cleaning by one of our lovely hygienists here at CPW. It is imperative that you remove the bacteria from your teeth in order to get the best result. Not only is it healthier for your gums, but you're going to really get the results that you want once all that soft and hard bacteria is cleaned off. One of the questions my patients ask me all the time is, does whitening cause sensitivity? And the answer is that sensitivity is a very common side effect of whitening treatment. Depending on how intense or non-intense the sensitivity is, really depends on you. A great adjunct to use during the whitening treatment is Sensodyne. I highly recommend using this before, during, and after your whitening treatment to lessen the risk of sensitivity. I also want you to know that the sensitivity is temporary. It's usually just confined to that time frame that you are actually bleaching your teeth. You may experience higher sensitivity to cold water or cold air, and using the Sensodyne toothpaste with its special formula is a great way to combat that. Once you've received your trays, you're going to be doing this at home. Primarily, I recommend it at nighttime just because we're winding down from the rest of the day and usually have a little bit more time to dedicate to it. For my first-time whitening users, I recommend using the whitening for 30 minutes. This is a good time to just gauge how sensitive your teeth are. Some patients are able to handle a full 60-minute treatment and others need about 30. So gauging where you're at with that, I think a good starting point is 30 minutes. If you do find that you're having little to no sensitivity after the 30-minute mark, feel free to bump up your bleaching time to 60 minutes. We don't recommend that you sleep in the bleaching trays, and we don't recommend that you exceed 60 minutes in one application. Prior to whitening your teeth, please brush and floss them ahead of time. The best results happen when your teeth are the cleanest.
Okay, so in your whitening kit, you should have received your syringes and your custom-made trays. Your custom-made trays can look anything like your Invisalign trays or your Clear Correct trays or the custom bleaching trays that we made for you in the office. So each syringe expels about 2 to 3 applications worth. It's a tiny little droplet that you're going to be making per tooth, as you can see here in the video. It's really small. A little goes a long way, guys, so don't feel like you have to use a ton in order to get a great result. So your custom tray should consist of the top and the bottom. It should fit very snugly when you pop it in. And what you want to do is place the bleaching agent at the outer surfaces of the teeth. As you can see here, I'm placing it on the side that you will see when you smile. And I'm only putting a little droplet. I'm not filling up the entire space because once you put the tray on, it's going to suction to your teeth and spread the bleach. So if you overfill the bleach, it will overflow the top and can irritate your gums. And I usually like to put the bleach to about my second premolar. It depends on how wide your smile is or so. Just make sure you're not putting the bleach on the chewing surfaces of your teeth. That is something that a lot of patients do by accident. You want to always keep the bleach to the outer surfaces. It's just not necessary to bleach the chewing surfaces of your teeth, and you don't see them when you smile, so make sure that you keep the bleaching agent towards the front. So something that can happen when you're using your whitening gel is that if your trays are wet or moist, if you wash them ahead of time, it can cause the bleach to not stick to the tray. As you can see in the video, it's a little gloppy, it's hard to remove, so just make sure your trays are very, very dry. And then once all of the bleaching gel is in each spot on the tray, you can pop them in. Make sure everything fits nice and snug, it pops in, and everything is covered evenly. You may find that a little bit of bleaching gel spills over the side, so you can just wipe it with your finger or with a clean tissue to avoid contact with your gums. Okay, so once the 30 to 60 minutes is up, you may remove your bleaching trays. So just pop them out, and I like to rinse them underneath some warm water, just making sure all of the whitening gel is removed out of those crevices and everything's nice and clean. I then take my toothbrush and run it underneath some warm water as well, and just gently brush my teeth and brush all of the bleaching agent off. Please use an extra soft or soft toothbrush. It's just going to be healthier for your gums overall and won't cause as much sensitivity. Once you have removed all of the bleaching agent, feel free to brush your teeth with Sensodyne.
I hope you find this video helpful, and don't hesitate to contact one of your lovely hygienists if you have any additional questions. See you soon!